Welcome back, everybody. Today we're tackling something that's more common than you might think and pretty darn important for medical microbiologists like you folks.
Oh, yeah, definitely.
Oral and dental infections. We're going to be dissecting Chapter 8.
Okay.
Oral and dental infections from the World Health Organization's AWARE Antibiotic Book.
Right.
Which, as you all know, focuses on promoting responsible use of antibiotics.
For sure.
And get this, untreated tooth decay is actually the most common health condition worldwide.
Wow. Yeah, it's really important to understand this stuff.
It really highlights how crucial this area is.
Absolutely. Oral health has a big impact,
Yeah.
wider implications than people realize.
Yeah, for sure. Okay, so let's unpack this.
Okay.
Starting with some definitions.
Right.
The WHO gives a clear glossary of terms, which is super helpful in this complex landscape.
Yeah, it can get complicated.
What are some of the key terms that we should know?
Well, it's important to know the difference between all the different conditions we see. Right.
So, for example, an abscess, whether it's apical, meaning at the tooth's root tip, or periodontal, involving the gums, it's basically a pocket of pus caused by an infection.
Got it.
Then you have the alveolar bone, which anchors your teeth. Pericoronitis is when you have inflammation around a partially erupted tooth, often a wisdom tooth. Then there's necrotizing periodontal disease, which is a severe gum infection that can actually cause tissue death. And then there's noma, a rare but really serious condition that can actually destroy facial tissues.
Oh, wow.
Thankfully, we don't see that too often in developed countries.
Noma sounds absolutely devastating.
Yeah.
It really shows how something as seemingly simple as oral health can become a very serious problem.
That's a great point, and that leads us right into the clinical presentation. Knowing the signs and symptoms and being able to tell the difference between conditions that need antibiotics and those that don't is really important for any medical microbiologist.
Because antibiotics aren't always the right answer.
Right. So let's talk red flags. What should we see and think, okay, this needs immediate attention?
You want to keep an eye out for signs like facial swelling, not just around one tooth, but beyond that. Difficulty breathing or swallowing, fever, rapid heart rate, that's called tachycardia, of course, and swollen lymph nodes or lymphadenopathy. These all suggest the infection is spreading and could become systemic. It could get into the bloodstream. That needs urgent medical intervention.
Got it. So those are the situations where we definitely don't want to delay.
Right.
Now, what are some conditions where antibiotics might not be necessary?
Okay, so this might surprise you, but dental caries, even when it gets worse and becomes pulpal disease, meaning the infection has reached the tooth's pulp, doesn't always need antibiotics. Dry socket, too. That painful thing you can get after a tooth extraction usually heals on its own. And maybe most surprisingly, periodontal disease or gum disease usually doesn't require antibiotics either.
Like periodontal disease.
Yeah.
But that's an infection, right?
Right. It's a good question. And it shows a key point. While bacteria are involved, periodontal disease is often driven by the body's own immune response to those bacteria.
I see.
So it's more about inflammation than a straightforward infection.
You're saying it's more about managing the underlying inflammatory process than just going after the bacteria.
Yeah, exactly. And that actually leads us into our next topic, laboratory tests. The WHO guidelines are pretty clear on this. Routine lab tests aren't usually needed for diagnosing and managing most of these infections.
Really? So no need for those cultures we're also used to?
Right. In most cases, no. Cultures might be helpful in serious cases, especially those needing hospitalization, to figure out exactly what's causing it and to make sure we pick the right antibiotic.
Right.
But generally, we use point-of-care tests and a good clinical exam. Those are the main tools for diagnosis.
Okay, so let's talk about these point-of-care tests. What are they, and how do dentists use them for diagnosis?
Okay, so first, we got to figure out where the pain is coming from. Is it the tooth itself or the gums and bone around it?
Gotcha.
There are some simple tests we can do right there in the chair, like the sensitivity test. That's where we apply something cold to the tooth. And if you feel that cold,
I can imagine,
it means the pulp is still alive, and we're probably dealing with something called reversible pulpitis.
So if there's no reaction to the cold,
it
means the tooth is basically dead.
Exactly. No response means a non-vital or necrotic pulp, which changes how we're going to treat it.
Got it.
Another helpful test is the percussion test. That's where we gently tap on the tooth. And if it's tender, it could mean there's an abscess hiding under the gum line.
Interesting. So it's kind of like dental detective work, right? Using these tests to piece together clues.
Yeah, I like that.
What about periodontal probing? The source material mentions that too.
Right, so that focuses on the gums.
Okay.
The dentist uses a little tool called a probe to measure how deep the pockets around the teeth are. Deeper pockets can mean gum disease. And if there's pus, well, it could be a periodontal abscess.
So it seems like we're relying on observation and these simple tests.
Right.
What about imaging? Do we ever use x-rays for dental infections?
Oh, absolutely. Dental radiographs or x-rays are really important. They let us see below the gum so we can tell the difference between what's causing the pain and whether there really is an abscess. They're really important for making the right diagnosis and figuring out how to treat it.
They're kind of like the confirmation.
Yeah, exactly.
Got it. So we've covered definitions, how these infections present, and the diagnostic tools. Now let's talk about treatment.
Okay.
And this is where that central message from the WHO comes in.
Yeah.
Most dental infections can actually be resolved without antibiotics.
That's right.
Really? But we're talking about infections.
I know, right?
Doesn't that mean we need antibiotics?
Not always. The best way to treat most of these infections is through a dental procedure.
Okay.
So we tackle the root cause, get rid of a decayed tooth, take out an impacted wisdom tooth, or drain an abscess.
So the focus is on fixing the underlying problem, not just masking the symptoms with antibiotics.
Exactly. Antibiotics might be helpful sometimes, but they can't replace dealing with the source of the infection. Of course, sometimes we do need antibiotics.
Right.
The WHO guidelines mention spreading infections in people who are immunocompromised.
Right.
Those are cases where we would definitely use antibiotics.
Okay, so let's talk about those cases where antibiotics are necessary. What are the go-to choices for dental infections?
Well, the WHO recommends amoxicillin or phenoxymethylpenicillin as the first-line antibiotics for most dental infections. And the AWARE book actually gives us specific dosages.
Oh, that's helpful.
It is. So for adults, it's 500 milligrams of amoxicillin every 8 hours or 500 milligrams of phenoxymethylpenicillin every 6 hours.
And what about for children? Are the dosages different?
You're right. For children, it's based on their weight. It's 80 to 90 milligrams per kilogram of body weight per day for amoxicillin, divided into doses given every 8 hours, or 10 to 15 milligrams per kilogram per dose of phenoxymethylpenicillin given every 6 hours.
Okay, so how long does someone usually need to take these antibiotics for?
Well, it depends on whether the dentist has been able to remove the cause of the infection, like a decayed tooth. If they have, then 3 days is usually enough. But if not, treatment should go on for 5 days.
Got it.
And patients should be checked again before they finish treatment.
So these are just general guidelines, right? The real treatment plan will depend on the individual patient and their infection.
Of course, you always have to think about the individual patient. It's
Correct.
crucial to talk to a dentist or oral surgeon for a proper diagnosis and treatment plan.
Definitely. So we've covered definitions, clinical presentation, diagnosis, and treatment. Now let's dive into the how, the pathophysiology behind these infections. Where does it all begin?
Well, it starts with the oral microbiota. That's the huge community of microorganisms that live in our mouths. And these microbes form a biofilm called plaque that sticks to our teeth.
Ah, plaque.
You got it.
The stuff our dentists are always telling us to scrub away.
Exactly. Now, when we eat sugars, especially sucrose, the bacteria in plaque go crazy. They love it. They eat the sugar and produce acid as a byproduct.
Okay.
And it's this acid that attacks tooth enamel, which causes those cavities.
So it's not just about how much sugar we eat. It's also about how well we remove plaque with brushing and flossing.
You got it. Brushing and flossing disrupt the biofilm, which helps prevent that acid from damaging our teeth.
So what happens if we slack off on our oral hygiene?
Uh-oh.
Does the decay just keep going deeper into the tooth?
I'm afraid so. If we don't do anything about it, caries can get through the enamel and into the dentin. That's the softer layer underneath. And eventually it can reach the pulp, which is basically the tooth's lifeline. It's got all the blood vessels and nerves.
Ouch.
Yeah, it can be really painful.
That sounds incredibly painful.
It is. When decay reaches the pulp, it causes inflammation called pulpitis.
Okay.
That's what often causes that throbbing toothache.
Oh, so that's why a toothache can be so painful.
Exactly.
Okay.
And if we don't treat that pulpitis, the pulp can actually die and become necrotic.
And that's when an abscess can develop.
Right. Once the pulp is necrotic, bacteria can get in, causing an infection and a pocket of pus at the root tip and abscess.
Wow, it's amazing how sugar and bacteria can cause this whole cascade of problems.
It really is. That's why preventive care is so important. Brushing, flossing, and watching how much sugary stuff we eat and drink.
Definitely. So we've covered the how. Now let's talk about the WHO. What does the epidemiology of oral and dental infections tell us?
Okay, well, as we mentioned earlier, untreated tooth decay is a global problem. It affects almost half the world's population.
Wow. That's just incredible. And is it the same across all age groups?
There is a bit of a difference, actually.
Yeah.
Caries is more common in young people, while periodontal disease is more common in older adults.
That makes sense.
Okay.
Are there specific risk factors that make people more likely to get these infections?
For caries, the big ones are a diet high in free sugars, not taking good care of your teeth, and not getting enough fluoride. For periodontal disease, it's things like smoking, stress, certain diseases like diabetes, and a weakened immune system.
So it's not just about brushing and flossing. Our overall health and lifestyle matter, too.
Yeah, you're right.
Oral health really is connected to our overall well-being.
It really is.
Okay, before we get into the specific bugs that cause these infections, let's do a little pop quiz.
All right, sounds fun.
We got some exam-style questions to see how much you've learned. Ready to put your microbiology knowledge to the test?
Bring it on. I'm ready.
Okay, question number 1. Which of these conditions usually does not need antibiotics? A spreading dental infection with facial swelling. B, severe pericoronitis that makes it hard to swallow. C, chronic periodontitis with gradual bone loss. Or D, a dental abscess with fever and a rapid heart rate.
Let me think. Okay, the answer is C, chronic periodontitis with gradual bone loss. Remember how we talked about how periodontal disease is more about the body's own inflammatory response to the bacteria rather than an infection that antibiotics can just wipe out?
Right.
The other choices, a spreading infection, severe pericoronitis, and an abscess with fever, all point to a more serious infection that would probably benefit from antibiotics.
That's right. 1 for 1. Okay, question number 2. Which point of care test helps figure out if a tooth has a vital pulp? A, percussion test. B, cold test. C, periodontal probing. Or D, radiograph.
This one's a bit easier, I think. The answer is B, the cold test. You know, putting something cold on the tooth to see if the pulp is still alive. If it is, it'll definitely let you know.
You got it. All right, question number 3. What's the recommended first-line antibiotic for a severe dental abscess in an adult with no allergies? A, metronidazole. B, clindamycin. C, amoxicillin. Or D, doxycycline.
The answer is C, amoxicillin. It usually works well against the bacteria we see in these infections, and it's usually well tolerated.
That's another right. Okay, 2 more to go. Question number 4. What's the main treatment for most dental infections? A, antibiotics alone. B, pain meds. C, dental procedures to actually remove the cause and drain the infection. Or D, antiseptic mouthwashes.
This goes back to that big message from the WHO. The answer is C, dental procedures to remove the cause and drain the infection. Antibiotics might be needed sometimes, but they can't replace actually fixing the root of the problem.
Absolutely. Last but not least, question number 5. Which of these is a big risk factor for getting cavities? A, high-protein diet. B, regularly using fluoride toothpaste. C, genes. Or D, eating lots of sugary foods and drinks.
This one is pretty straightforward. The answer is D, high consumption of free sugars. That sugar is like a buffet for the bacteria that cause tooth decay.
5 for 5. You aced those questions. Now that we've got the basics down, let's dive into the world of those microbes, the oral microbiota. What can you tell us about the most likely pathogens behind these infections?
Well, like we mentioned earlier, our mouths are home to a ton of different microorganisms. That's the oral microbiota.
Right.
And it plays a huge role in keeping our mouths healthy, but also in causing problems when things get out of balance.
So it's not just about bad bacteria causing trouble.
Exactly. In a healthy mouth, it's all about balance, but when that balance gets messed up, certain bacteria can take over and start problems.
So who are the usual suspects when it comes to dental infections? Who's causing all the chaos?
When it comes to cavities, the main troublemaker is Streptococcus mutans. This guy loves sugar and produces lactic acid, which is what eats away at the enamel and causes those cavities.
So Streptococcus mutans is who we can blame for all those trips to the dentist.
Pretty much.
Okay. What about periodontal disease? Are there different bacteria involved there?
Yeah, periodontal disease is usually linked to different bacteria, mostly anaerobes. They thrive in those deeper pockets that form around teeth when you have gum disease.
Oh, I see. Can you give us some examples of those anaerobic bacteria?
Sure. Some of the key players are Porphyromonas gingivalis, Prevotella intermedia, and Tannarella forsythia. They release toxins and enzymes that cause the inflammation and tissue destruction that we see in periodontal disease.
It sounds like our mouths are a real battleground for different bacteria.
That's a great way to put it. And who wins that battle depends on a bunch of things. our oral hygiene, diet, overall health, and even our genes.
This really shows how connected oral health is to our overall well-being.
Yeah, for sure.
Speaking of connections, was there anything else in Chapter 8 that really stood out to you?
What really stuck with me was how much they stressed source control as the most important treatment for most of these infections.
Right, we talked about that. Addressing the root of the problem, not just throwing antibiotics at it.
Exactly. And the WHO guidelines go into a lot of detail about different dental procedures used for source control, like extractions, root canals, and draining abscesses. It's good to remember that dentists are really important in fighting these infections. They're the ones who can fix the problem, not just cover it up with meds.
Right. Sometimes the answer isn't in a lab, it's in the dentist's chair.
Exactly. This deep dive has really given us a lot to think about. It's not just about identifying the bacteria, it's about all these different factors that contribute to oral and dental infections.
For sure. And it's a reminder that even infections that seem minor can become serious problems if we don't treat them.
Speaking of serious problems, we haven't talked much about the global impact of oral and dental infections. The epidemiology section of Chapter 8 goes into that.
You're right. We did mention that untreated tooth decay is the most common health problem in the world.
Right.
But what else does the WHO say about the epidemiology of these infections?
Well, they say that oral diseases, including cavities and periodontal disease, are a huge public health problem all over the world. And while we can mostly prevent them, they still affect millions of people, especially in low-income countries where people don't have easy access to dental care.
That's a really important point. Access to dental care, education about oral hygiene, even things like what we eat, all play a role in how common these infections are.
Absolutely. It's a really complex problem. And the WHO says we need to have strategies that address all these issues, like promoting good oral hygiene, reducing sugar intake, making sure people have access to fluoride, and improving access to affordable dental services.
So it's not just about individual choices. It's a public health issue that we all need to pay attention to.
I agree. And this takes us back to one of the main messages from the WHO. Prevention is really important.
Yeah, that old saying, an ounce of prevention is worth a pound of cure.
Exactly. And prevention starts with education. We, as medical microbiologists, need to spread the word about how important oral health is, not just to our patients, but to our colleagues and everyone in our communities.
Absolutely. We need to champion healthy smiles.
For sure.
Okay, so as we wrap up this deep dive, what are your main takeaways for our listeners, especially those medical microbiologists who might see these infections in their practice?
I think the biggest takeaway is that even though we know a lot about the microbial world, oral health really needs a team effort.
Yeah.
We have to work with dentists to make sure patients get the best care. We bring our knowledge of microbes, antibiotics, and systemic health, and dentists bring their expertise in diagnosing, treating, and preventing these oral diseases.
So working together, we can get the best results for our patients.
Exactly.
Collaboration is key. I like that. And like you said earlier, we can't forget about the global impact of oral health. It's not just about individual patients. It's about fighting for better oral health education and access to care, especially in those communities where these diseases are most common.
Yeah, you're right. We have a responsibility to use what we know to advocate for policies and programs that promote oral health equity and really make a difference in people's lives.
Couldn't have said it better myself.
Yeah.
This has been a really eye-opening deep dive into oral and dental infections. We've gone beyond just naming the bad guys and really looked at that connection between oral health and our overall well-being.
It's fascinating, isn't it?
It is. It really is. It's clear that a healthy mouth means a healthy body.
Definitely.
Well, it's been a pleasure having you with us today, exploring this important and often overlooked area of health.
It's been my pleasure. Thanks for having me.
And to our listeners, thanks for joining us. If you want to learn more about oral and dental infections, check out Chapter 8, Oral and Dental Infections, in the WHO's AWARE Antibiotic Book. It's full of great information and practical advice. Until next time, stay curious, keep those smiles bright, and keep those microbes in check.